Hello, thank you for the opportunity to talk about sustainable development goals as outlined by United Nations, as well as their impact on mental health in my community, that is Kenya, and in many other communities in both developing and also already developed countries. So I think that by putting efforts towards sustainable development goals, will have already addressed the social determinants of mental health, and therefore we will that will have a transformative effect towards mental health in our communities. So let's dive in now and know how this particular sustainable development goals will have an impact in mental health in our communities. To start with, if you look at the sustainable development goal number 2, which is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. This development goal is meant to address food insecurity, which is a major concern in most of the developing countries, whereby there is lack of food, or the food that is available, it is inadequate, lack of balanced diet, undernutrition of the elderly, which causes health problems like anemia. So if we put measures, if we work towards achieving food security, adding hunger, as well as improved nutrition amongst the community members, this one will have dealt with the food insecurity as a determinant of mental health in most developing countries. Sustainable development goal number 3, it ensures healthy lives and promote well-being for all ages. This particular sustainable development goal is meant to increase access to quality healthcare that will lead to both the physical well-being and as well as the mental well-being. There has been there has been health gaps in most developing countries, whereby the number of mortality, especially for pregnant mothers, the number of diseases like malaria, HIV, and all that have gone up. So if we ensure that we have worked on the health care by ensuring health well-being of the individuals, will have dealt with this. Will have dealt with the determinant of mental health, that is poor health. Sustainable development goal number 8, which is decent work and economic growth. Unemployment and job insecurity and financial stress are major risk factors for poor mental health in most developing countries, and in particular Kenya. And therefore, by promoting inclusive and sustainable economic development, we can create more opportunities for meaningful work, living wages, as well as financial security among the people. All of which these ones are essential for mental well-being. If you look at the sustainable development goal number 10, which is reduced inequality. If we address the deep inequalities in our community, whether by race, gender, or socioeconomic status, we will have improved mental health. Development goal number 5, achieve gender equality and empower all women and girls. This particular SDG is meant to address the social inequality, as well as the violence and the gender-based violence, and yes, empower women and promote equality in politics and leadership. This one will also put an end to child marriage, thereby improving the mental well-being of women and children in the society. Sustainable development goal number 4, which is ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. This one will of course ensure promote better health, better employment opportunities, as well as the overall well-being for people, because schools are platforms for awareness and empowering individuals. So therefore, if you look at goals related to quality education, development goal number 4, gender equality, decent work, and economic growth, they all contribute significantly towards improving socioeconomic conditions that influence individual stress, levels as well as self-esteem positively, thereby impacting their their emotional stability over time. Environmental sustainability is also a key. It's also a key factor that has affected many developing countries, and that is under the Sustainable Development Goal number 13, climate action. And I believe that it plays a significant role by reducing natural disasters, impact leading to post-traumatic stress disorders cases due to climate change related events like floods and droughts. In conclusion, therefore, I believe if all stakeholders, that is the government, the NGOs, the private sector, if they all come together and make efforts towards the discussed sustainable development goals, I truly believe that we will see a profound and positive impact on the mental health of our community, and particularly in the developing countries. Healthier, more financially secure, and more equitable communities, I believe, are the foundation for thriving mental well-being. By working together towards the sustainable development goals, we can build a future where mental health is celebrated, supported, and accessible to all. Thank you so much for your time and for the opportunity to talk about the impact of sustainable development goals on mental health of my community.